Welcome to Journey to 600. Today we're going to talk about orthopedic conditions, pediatric edition part 2. So in the other one we covered lots of things about the hip, knee, ankle, foot, but today we're going to focus more on the spine. So we're going to talk about torticollis and scoliosis. What is its presentation and what is the treatment? So starting off, torticollis, what is it? It is due to tightness of the sternocleidomastoid muscle, or SCM. So the actions of the SCM are ipsilateral tilt and contralateral rotation. So the right SCM will perform right side bend and left rotation of the neck. Presentation of torticollis, so their posture will not be a midline, so they will be rotated and tilted to the opposite direction. So you might see if a child has left torticollis, you'll see a left lateral tilt and a right rotation preference, which indicates torticollis. If a child has a left lateral tilt with a left rotation preference, this is an atypical presentation and may warrant referral for imaging. You will see limited active or passive range of motion of the SCM, so therefore we're going to be looking at what is their tilt bilaterally, what is their rotation bilaterally. You might notice a flat spot on their head. So flat spot typically occurs on the same side as rotation. So right SCM has a right tilt, left rotation. So right torticollis will be a left posterior flattening. The tightness of the right SCM is right torticollis. And then you could also see some facial deformities, and we'll talk about that on the next slide. But one of the special tests that you can perform is called the muscle function scale. And you hold the child at 90 degrees horizontally, and you score the number if it is held for 5 seconds. So you want to test bilaterally to observe tightness versus weakness. The muscle function scale gives an objective measure to determine that strength and tightness related to the lateral tilt. So a child with a tight side up will be able to hold against gravity well since it is tight, but a child with the uninvolved side up, they might have difficulty righting their head due to the restriction on the contralateral side, and it is also typically weaker since it doesn't work in that full range due to the tight muscle. So for example, you would score a 0 if their head is less than 0 and it cannot even get past the horizontal. So this child might have a right tight SCM, and so therefore they can't even get their head to neutral against gravity. A 1 means that they can get their head to the horizontal. Score them a 2 if they're between 0 and 15 degrees. And then 3 if it's 15 to 45 degrees, 4, 45 to 75 degrees, and then you would score 5 if they can get greater than 75 degrees. So if they had a left torticollis, the left side bend would be able to hold position easily due to the tight muscles, but if they had to do a right side bend, they may not be able to right their head due to the SCM restriction and weakness, which I already kind of mentioned, just putting it out there for an example. There are other ways to grade torticollis, so you can also look at the severity of torticollis, and this is based on how large their restriction is between sides and also their age at referral. So I'm not going to read all these out, you can kind of just study these on your own, but a grade 1, which is early mild, they're 0 to 6 months at referral with the postural or muscle tightness less than 15 degrees. Grade 2, they're still going to be in that same age, but the tightness or the difference between sides is even greater, so 15 to 30 degrees. And then a grade 3 is severe muscle tightness that is limiting them greater than 30 degrees between sides, or you can actually feel a mass on their SCM. A grade 8, which is very, very late, this means the child is greater than 12 months at referral with any asymmetry, including postural or an SCM mass. So hopefully we're not seeing a lot of kids at grade 8, but I mean, you might. Types of plagiocephaly. So there are 5 different types. Type 1 being the least severe, but you will see that posterior flattening is what we talked about earlier. So that'll be the first thing you see with torticollis is that posterior flattening on the side of rotation. Then once they have that posterior flattening, you could possibly see some ear shift, and it will start moving more anterior. Then ear shifts, then you'll see some forehead deformity. Then you will start seeing cheek, face, and jaw deformity. And lastly, you could see vertical or temporal deformity, which is a type 5. So treatment of torticollis. So it's pretty simple. It's basically what you're going to do for any other child in physical therapy. So you're going to find their impairments and treat those impairments. So you're going to stretch the SCM. So you would stretch the right SCM by doing a left lateral tilt and right rotation. You're going to strengthen by encouraging in range right rotation and propping in right sideline to encourage the riding of the neck to get a left lateral tilt. So these actively stretch the right SCM. So you're going to do that, which also it strengthens the left SCM, but while you strengthen the left SCM, it's going to be stretching the right SCM more in an active way versus passive. You're going to offer multiple positions for play, such as sideline, prop sideline, tummy time, supported sitting, so that it will prevent some of those posterior flattenings. You're going to encourage midline posture during play, so even if they're on their back, encouraging them to be looking straight ahead, to play like that. You could refer for a helmet based on age and severity. So referral for helmet is best between the ages of 4 to 6 months because their skull is not completely fused. And sometimes companies will take them up to 8 months or a year. If it is pretty significant torticollis, you may not be able to just fix it through positioning. You might need that external force of a helmet. If PT is not helping unload the skull, then you need to refer to a helmet, or if it has significant skull facial deformities present. Family education on positioning, handling stretches, and minimizing time in containers. So basically all the things you're doing in therapy, tell them why. So educating on position, like we don't want them to be in containers all the time so they can have freedom of movement, so they can rotate their neck to both sides, and show them how to stretch the SCM to be most effective overall. Okay, scoliosis. So the picture on the right is obviously scoliosis. You can see scoliosis is a laterally curved spine. And scoliosis is typically named for the convexity. So basically the point or the hump part. So in this picture, it is right thoracic scoliosis. So it's named for the convexity and where it's at. So this is a thoracic spine with a convexity to the right. So right thoracic scoliosis. Its presentation, you're going to look on the convex side and the concave side. So the convex side, typically the shoulder is elevated, the vertebrae is rotated to that side, they have a scapular prominence, you will feel their scapula more on that side, and you will see a rib hump. On the concave side, they will be in more lateral flexion, and that is where you'll feel the rotation of the spinous process on the left for this picture. So, the rotation of the vertebrae is to the right, but you feel that with the spinous process on the left. So treatment of scoliosis, you're going to strengthen the convex side because they are stretched and weak, so like the spinal extensors and lateral trunk flexors. Then you're going to stretch the concave side because they are shortened, so again the spinal extensors, lateral trunk flexors. For monitoring and referral, it is monitored through the measurement of the Cobb angle, which is that picture to the right. So an increase in greater than 5 degrees in 1 year, you want to refer to the orthosis fitting. Less than 25 degrees, a patient should be monitored every 3 months. 25 to 40 degrees requires spinal orthosis and NPTE intervention for posture, flexibility, strengthening, respiratory function, and proper utilization of the spinal orthosis or the Milwaukee brace. Greater than 40 degrees requires surgical spinal stabilization, and you want to refer to an orthopedic surgeon. Practice question number 1. A 4-month-old child is referred to physical therapy for torticollis. You observe a left lateral tilt. Which of the following is correct? I'll give you a moment to answer. If you're not ready to go over the answers, please pause. This child has a left lateral tilt, meaning they have left torticollis. So left torticollis presents with left lateral tilt, right rotation. A is incorrect because they actually have a tight left SCM. Limited right rotation is incorrect because they are going to be in a right rotation. Plagiocephaly on the posterior right side of the head. So we said flatness is observed on the side of rotation. So left lateral tilt is right rotation, so that does match up. Since they're rotated to the right, they will have posterior flattening on the right side of their head. So C is the correct answer. Next question. A 13-year-old patient presents to PT with a referral for thoracic scoliosis. You observe convexity of the thoracic spine to the left. Which of the following is a posture you would observe? I'll give you a minute to answer. If you're not ready to go over the answers, please pause. So, convexity to the left means it's left thoracic scoliosis. So, breaking it down on convex side versus concave side. So, on the convex side, you should have left shoulder is elevated. So that takes out D. You should have left rotation of the vertebrae. Not one of the answers. Left scapular prominence. Not one of the answers. And you have a left rib hump. That takes out C. On the concave side, you would see right rotation of the spinous process. Takes out A. So that leaves B, right lateral flexion. So on the concave side, which is the right side, you will see right lateral flexion, which is B, right lateral flexion. Thanks so much for watching. Don't forget to like this video, subscribe to our channel, and turn on notifications. See you next time on your journey to 600.